If any of you have questions, I'm happy to answer them, or later, as the case may be.
Firstly, I would like to thank Dr. Swain for this nice lecture, and I have just a little question about this chipping. You mentioned that chipping always occurs during production. I mean, the cause during the lab work. During the production, what is the rule of the differences or the mismatch of the elastic modulus after insertion of the bridge or whatever? What is the effect of the force due to mismatch in the elastic modulus between porcelain and zirconia? Is there a rule?
No, I'm sorry if I conveyed the issue. I'm not saying that the cracking is occurring during the technicians. I'm saying that the cracking that most people have seen is occurring in clinical because of the lab component, and also the fact that you guys do an adjustment. We can't completely blame the technicians. You have to accept some responsibility yourselves in terms of that adjustment. Mismatch of elastic modulus is not such a critical issue. Why? Because the mismatch of elastic modulus, if there is minimal difference in the coefficient of thermal expansion, there are limited residual stresses that are caused by that. If there are big residual stresses, or difference in coefficient of thermal expansion, then yes, you can get big residual stresses in that, and they will be dependent upon the elastic modulus. But in the case of the porcelain system, the residual stresses in the porcelain are virtually independent of the elastic modulus of the framework. We've looked at, for instance, porcelain bond to a glass ceramic with an elastic modulus of, say, 100 gigapascals, to zirconia 200, or alumina 400. And what we found that in the case of the porcelain, there was virtually limited difference in the residual stresses, with the same CTE difference between the two. There were much higher stresses that were generated in the coping material. The stresses were greatest for the alumina with the higher elastic modulus, intermediate for the zirconia, and least for the glass ceramic system. Secondly, we've had a lot of experience now with alumina, with in-ceramic material. We're not seeing a lot of chipping and fracture problems with those systems. So those stresses with that are usually minor in comparison to this tempering stresses. And why we haven't seen these tempering stresses? Because the alumina, the metals, are good thermal conductors. So they will redistribute the heat relatively quickly from different areas. And we've done finite element analysis in other systems. And you can see, if you can compare alumina base with a zirconia base, the temperature is much, much greater in the case of the zirconia on the porcelain zirconia than it is in that. In our thermal expansion, in our cooling curves, in the case of porcelain on alumina, they're lower, much lower thermal differences. People have been cutting and looking at residual stress profiles. Again, much, much lower residual stress profiles in the case of alumina than they are with zirconia. All of it is talking, is really getting back to this issue of that process. Now, if the CTE is too big, then yes, you can get a difference, particularly if you have a crown, which is very much like a spherical type object. Now, if the core contracts much greater than the case of the porcelain that's on top of it, yes, you can get contraction stresses. But usually there's a limit what the companies will manufacture, this match between the CTE between one and the other. And so we are not seeing that really manifest so significantly in terms of chipping. Another former student of mine made these spheres where they actually changed the CTE of the porcelain and changed that of the zirconia on the inside. They changed the diameter, and they found that the critical issue was rapid cooling. If they rapidly cool, they got far, far more cracking and failure than if they slowly cooled those same systems. Even when the CTE was something like a 20-30% difference in that between the two, it was nowhere near as significant as the rapid cooling. Look, I think both of them can work. There are many examples that people have used porcelain fused to zirconia, and it's had 10 years life, and there has been absolutely no problem with it. To me, it's a question, if the technician does his work properly and he's aware of how to do it properly, then you can get the lifetime out of these systems. Much the same lifetime of that of zirconia. I think in terms of the aesthetics, then potentially the zirconia is better. Particularly if there's any recession or whatever, things such as that, you don't get that metal sort of look about it. For some people you get metal sensitivity as well with gingival response process to that systems and so. Whether they're better than gold, that's another issue. As a clinician, most clinicians I know love gold and in their mouth rather than anything else. So. And again, if you look at the bonding of porcelain to gold, it is fantastic in terms of the adhesion component of that. Certainly much, much better than I've measured for porcelain bonding to zirconia. So I can't give you a definitive answer there, but to me, I think if in the hands of a good technician and good clinician, either system will work very well. Well, look, I think at this stage we've only had 10 years' experience with the zirconia systems. And really, I think, that's with very limited groups of people that have been doing that. What I'm hearing is that chipping, if it doesn't take place in the first 3 years, then it's not a problem. And after that, the systems almost behave virtually the same as a porcelain fused to metal. Some people are arguing that instead of having thick layers of porcelain, you have a thicker layer of the coping material in the case of zirconia, and then you've got less likelihood of chipping. But now you have an aesthetics problem, because now you've got a thinner layer to, if you like, to block out the thinner layer of porcelain to block out the opacity of the underlying zirconia underneath that system. So, look, the days are still early in this process, but I suppose the question comes, what would I use if I was in my mouth? And I think I would be happy with either one. And if I had a good technician and a good clinician that was able to do the work, I think either of those systems would work. The problem is that a lot of people are not completely aware, particularly the technicians, and also the companies aren't telling about this critical issue of slow cooling. And we do find that in some furnaces it's much worse than others. Particularly the furnaces that have a clamshell function like this, the problem of chipping incidence is far greater than the classic systems which slowly drop out from below.